If you've been checking with your doctors about which plans they accept, chances are that you may have come across a provider who tells you that Medicare Advantage plans are bad. Or perhaps you're turning 65 soon, have been asking your friends about Medicare options. You might have heard some of them share reasons why they would never enroll in a Medicare Advantage plan. So, are Medicare Advantage plans really bad coverage? Fortunately, the answer is no. Medicare Advantage plans are actually an important option within Medicare, and it's great that you have choices. The reality is that Medicare Advantage plans are often misunderstood, and this is a direct result of people not doing their proper research before joining a plan. Too many Medicare beneficiaries attempt to enroll in coverage on their own after listening to a misleading TV commercial. They miss out on the free assistance available from Medicare insurance brokers like Boomer Benefits, where we thoroughly explain the plans up front before helping you to enroll in a plan. As a result, they often overlook important details and may end up unhappy with their plan. However, this isn't the fault of the plan itself. The way these plans work is highly regulated, and they pay just like they're supposed to. So let's dive into some of the reasons why some people believe Medicare Advantage plans are bad. I'll share common concerns reported by Medicare beneficiaries over the years about these plans. Then you can decide for yourself whether a Medicare Advantage plan is right for you. When you're covered by a Medicare Advantage plan, you usually pay lower monthly premiums compared to a Medicare supplement plan. However, the trade-off is that you will incur copays or coinsurance out of pocket as you use healthcare services. In years where you are using more healthcare services, you may feel like you are coming out of pocket a lot for various copays and coinsurances that you may owe. With Medicare Advantage plans, you will pay for healthcare services as you receive them at the time of treatment. This is the opposite of how a Medicare supplement plan, such as Medigap Plan G, would operate. With Medicare Supplement Plan G, you pay a higher premium upfront, usually well over $100 a month, but you benefit from minimal out-of-pocket costs later on. Once your yearly deductible is met, there are no copays for medical services such as doctor visits, lab work, or physical therapy on a Plan G. You won't face daily hospital copays or coinsurance for other Part A and B services either, such as cancer treatment, durable medical equipment, or diagnostic imaging. For someone transitioning from a Medicare supplement to a Medicare Advantage plan, the pay-as-you-go feature can feel different. You might find yourself paying $10 or $20 for a primary care visit, or $30 or $40 to see a specialist. If additional services are needed, like blood work or an MRI, you'll likely also have to pay a copay for those as well. This might catch you off guard if you haven't done your homework on how Medicare Advantage plans work. Fortunately, there's a really easy way to avoid this issue. Before enrolling in a Medicare Advantage plan, carefully review the plan's summary of benefits. If you're working with a Boomer Benefits, our agent will provide this upfront and will walk you through it. This summary outlines all the costs associated with various medical services in detail, helping you understand what to expect. For example, if you have diabetes, check what your share of the cost will be for diabetes supplies. If you require oxygen for a breathing disorder, find out what the summary says you will pay for that, as it's likely to be a recurring expense throughout your lifetime. By thoroughly reviewing the summary in advance, you can avoid surprises down the road. Unfortunately, many people overlook the fine print, leading them to believe that their Medicare Advantage plan is inadequate, when in reality, it simply operates differently from a Medigap plan. In fact, it actually operates pretty similar to group health insurance that you have had through employers during your working years, where you pay copays and coinsurance as you seek healthcare services. Medicare Advantage plans are funded by Medicare itself. When you enroll in one of these plans, Medicare pays the insurance company a nice chunk of change each month to assume your healthcare risk. Many Medicare Advantage plans will set very low premiums for their plans so that when you join, the plan can get paid by Medicare. It's normal to find many plans that even offer a zero premium for the plan itself. However, the zero premium can lead to confusion among beneficiaries. As discussed in my book, 10 Costly Medicare Mistakes You Can't Afford to Make, many Medicare beneficiaries mistakenly believe that a zero premium on their Medicare Advantage plan means they no longer need to pay for Part B. This is false. Enrolling in a zero premium Medicare Advantage plan does not eliminate your obligation to pay for Part B. You must stay enrolled in both Parts A and B the entire time that you are enrolled in a Medicare Advantage plan. And it can be quite surprising for individuals who enroll in a Medicare Advantage plan expecting their Part B premium to stop being deducted from their Social Security check. We have even seen some folks get this really wrong and try to cancel Part B after joining an Advantage plan. This will automatically boot you from the Advantage plan, and it may result in many months of no outpatient coverage for yourself while you wait for Medicare's next general enrollment period to come around, allowing you to re-enroll in Part B. If you choose Original Medicare with the Medigap plan, you have access to nearly 1 million providers nationwide. There's no network restriction. You can see any doctor who accepts Medicare. However, Medicare Advantage plans develop local or regional networks closer to your home. Depending on the plan, this network might include a few thousand providers, and it may span just one county or several counties, or even extend statewide. Some people enroll in a Medicare Advantage plan without realizing that there is a network limitation. They might not check whether their preferred doctors and hospitals participate in the plan's network, which can lead to disappointment if they find out the provider doesn't accept that coverage when they need care. This one is also quite easy to avoid. Make sure to confirm that your provider participates in the exact plan that you are considering. I give detailed instructions on how to ask these questions in my book. Checking the correct directory for your plan is also crucial to avoid any confusion. You want to confirm that the plan's online provider directory includes your necessary providers. Insurance companies may offer multiple networks in the same area, such as both HMO and PPO plans, which can and will have different participating providers. So it is important to confirm that your intended plan is the one accepted by your favorite doctors and hospitals. If Boomer Benefits is helping you, we take these steps for you to avoid you putting in this work. Keep in mind that some plans may require you to designate a primary care physician. If you enroll in a Medicare Advantage plan with a standard HMO network, then you will usually have to choose a primary care provider. That doctor will likely need to issue you a referral before you can see a specialist. While some individuals appreciate the structure for its coordinated care, others may find it inconvenient. If you think this might be a hassle, you may want to consider plans with greater provider flexibility, such as a Medicare Advantage PPO plan or a Medigap plan. In our New to Medicare webinars, one point I always emphasize is that Medicare Advantage plans can change their benefits every year. And this means that premiums, provider and pharmacy networks, copays, coinsurance, and deductibles can vary from one year to the next. Even the medications included in the plan's formulary may change, making your coverage on January 1st potentially different from what it was on December 31st. This means that if you enroll in a Medicare Advantage plan, you must do your due diligence every single year. I recommend setting aside some time in September to review the annual notice of change letter that your plan will send you. This letter will outline any modifications, allowing you to make informed decisions about your current coverage. If you find that the changes no longer benefit you, you can use the upcoming fall Medicare annual election period to choose a different plan. Pay attention to the ancillary benefits that many Medicare Advantage plans offer as well, such as dental, vision, and hearing coverage. While these perks might be nice, they might be a nice benefit, it's important for you to read the fine print as they have limitations too. And these particular benefits may be very limited. For instance, a dental benefit might only cover preventive services, leaving you responsible for more expensive dental work. Or similarly, a plan may offer a $100 credit toward eyeglasses every 2 years, which probably is not enough to cover the full cost of a new pair. It's also important to note that these ancillary benefits can change from year to year. If you joined a plan primarily for a specific eye exam benefit, you could be surprised if that benefit is modified or removed in the next plan year. If you aren't likely to sit down and do your homework each year, you may end up feeling disappointed with your Medicare Advantage plan when really it was simply that the plan exercised its annual right to change its benefits. Medicare Advantage plans all will have an out-of-pocket maximum limit to protect you, and this is a good thing. This limit is designed to protect you from spending beyond a certain dollar amount each year on Part A and B services. The downside is that plans can set that out-of-pocket as high as $93.50 for in-network services in 2025. And for beneficiaries on fixed incomes, the thought of reaching this maximum can be daunting, especially if you require frequent healthcare services. While you may only encounter these high costs during periods of significant medical care, it's important to understand how certain services can impact your out-of-pocket expenses. So, for example, coinsurance for services like durable medical equipment, chemotherapy, radiation, and dialysis can be as much as 20%, leading to substantial charges for you. If you're concerned about managing high out-of-pocket expenses or you don't have the savings set aside for unexpected medical costs, it might be worth exploring a Medigap plan. These plans typically offer more predictable out-of-pocket expenses on the back end, providing peace of mind when it comes to your healthcare finances. Another option is to purchase small ancillary policies that pay you cash benefits in the event of a hospital stay or cancer diagnosis. They will help you meet any expenses you encounter for a serious illness while on an Advantage plan. And these ancillary policies are often inexpensive, and they're a great way to shore up your benefits without having to take on the higher premiums of a Medigap plan. Insurance companies, including those that manage Medicare Advantage plans, are in business to make money, so in general, they must ensure that treatments and services provided are medically necessary. For some services, your plan might require that your provider obtain a prior authorization for the service or treatment before it's provided to you as the patient. Sometimes prior authorization requests can take a few days for approval. We also see some prior authorizations can get denied because the plan doesn't deem the service to be reasonable and necessary. This is becoming less common as providers are accepting more Medicare Advantage plans and the plans are progressing over the years. Prior authorizations are just an ordinary part of the world of health insurance, and it doesn't mean that your plan is bad. We help our clients with appeals when a prior authorization is denied, and statistically, about 85% of these denials are overturned on appeal. While it's clear that Medicare Advantage plans may not be the ideal fit for everyone, we've found that our clients at Boomer Benefits who choose Advantage plans are quite satisfied with them. This is probably because of our team's commitment to providing thorough, detailed explanations of how each plan works during the enrollment process, ensuring that there are no surprises down the road. If you're exploring whether a Medicare Advantage plan is the right choice for you, we encourage you to check out our other videos here on YouTube.